The vertebral column or spine consists of the 33 vertebrae that provide the framework for the central axis of the axial skeleton. For classification purposes, the vertebral column can be arbitrarily divided into 5 regional groups. From superior to inferior, these are the 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, 5 sacral vertebrae, 4 coccygeal vertebrae. 24 of these vertebrae, that is, the cervical, thoracic, and lumbar, are unfused and are known as true vertebrae. They become progressively larger from superior to inferior. The remaining 9 vertebrae, that is, the sacral and coccygeal, are fused and are known as false vertebrae. They become progressively smaller from superior to inferior. The fused sacral vertebrae collectively form the sacrum, while the fused coccygeal vertebrae collectively form the coccyx. When viewed laterally, the full length of the adult vertebral column is seen to have 4 curvatures: cervical lordosis, thoracic kyphosis, lumbar lordosis, sacral kyphosis. Atlas. Quick facts. Location: vertebral column. Bone type: irregular bone. Arterial supply: vertebral arteries. Key features and anatomical relations. The atlas first cervical vertebra, or vertebra C1, is one of the 7 cervical vertebrae of the vertebral column. It is considered an atypical cervical vertebra because some of its features differ to those of typical cervical vertebrae, such as the absence of a vertebral body and spinous process. It articulates with the axis at both the median and lateral atlantoaxial joints. Occipital bone at the atlanto-occipital joints. Ossification. Ossification of the atlas occurs at 3 ossification centers. These are found in the right and left lateral masses, with 1 center found in each, which appear in utero during the 2nd month. Anterior arch, which appears during the 1st year after birth. The ossification centers for the right and left lateral masses fuse with each other to form the posterior arch during the 3rd to 4th years. The anterior arch fuses with the lateral masses during the 6th to 8th years. List of clinical correlates. Fracture, osteoporosis, spinal stenosis, scoliosis, atlanto-occipital assimilation, dislocation of atlanto-occipital joints, dislocation of atlantoaxial joints, spina bifida, parts of atlas. 1. The anterior arch is the short, curved, anteromedially located part of the atlas first cervical vertebra. It is the shorter of the 2 arches of the atlas, the other being the posterior arch. Provides insertion sites for the superior oblique parts of both the right and left longus cervicis muscles. Provides attachment sites for the anterior longitudinal ligament and anterior atlanto-occipital membrane. 2. The lateral masses are the 2 expanded, oval, laterally located parts of the atlas first cervical vertebra. Provides an origin site for a rectus capitis anterior muscle and an attachment site for the transverse ligament of atlas. 3. The posterior arch is the curved, posteromedially located part of the atlas first cervical vertebra. It is the longer of the 2 arches of the atlas, the other being the anterior arch. Provides origin sites for both the right and left rectus capitis posterior minor muscles. Provides attachment sites for the nuchal ligament, ligamenta flava, and posterior atlanto-occipital membrane. 4. The transverse processes are the two small, laterally projecting processes of the atlas first cervical vertebra. Provides attachment sites for muscles of the neck and upper back. 5. The foramina transversaria are the small, oval, laterally located openings found on the transverse processes of the atlas first cervical vertebra. 6. Overall, all 7 cervical vertebrae have a pair of foramina transversaria, although they may be absent in the 7th cervical vertebra of some individuals. The foramina transversaria of the upper 6 cervical vertebrae allow for the passage of the vertebral arteries and veins, while the foramina transversaria of the 7th cervical vertebra only allows the passage of the accessory vertebral veins. 7. The vertebral foramen is the large, centrally located opening of the atlas first cervical vertebra. 8. The vertebral foramen of atlas is divided into 2 areas by the transverse ligament of atlas. The anterior area holds the dens of the axis. The posterior area contributes to the formation of the vertebral canal, which extends throughout the length of the vertebral column. The vertebral canal allows for the passage of the spinal cord, along with its accompanying meninges and vasculature. Overall, the size and shape of the vertebral foramina in the different regions of the vertebral column are as follows. Cervical vertebral foramina are the largest and triangular. Thoracic vertebral foramina are the smallest and circular. Lumbar vertebral foramina are intermediate in size and triangular. Landmarks of atlas. 1. The anterior tubercle is the rough, small prominence found along the midline on the anterior aspect of the anterior arch of atlas first cervical vertebra. It provides an attachment site for the anterior longitudinal ligament. 2. The articular facet for dens is the concave, oval, posteriorly facing articular area found along the posterior aspect of the anterior arch of atlas first cervical vertebra. It articulates with the anterior articular facet of the dens axis, forming the median atlantoaxial joint. 3. The grooves for vertebral arteries are the large, smooth depressions on the upper aspect of the posterior arch of atlas first cervical vertebra. The vertebral arteries and the first cervical nerves pass through these grooves. 4. The inferior articular surfaces are the smooth, flat, inframedially facing articular areas found along the lower aspects of each lateral mass of the atlas first cervical vertebra. They articulate with the superior articular facets of the axis, forming the lateral atlantoaxial joints. 5. The posterior tubercle is the rough, small prominence found along the midline on the posterior aspect of the posterior arch of atlas first cervical vertebra. It is the equivalent of the spinous processes of other cervical vertebrae and provides an attachment site for the nuchal ligament. 6. The superior articular surfaces are the smooth, concave, supramedially facing articular areas found along the upper aspects of each lateral mass of the atlas first cervical vertebra. They articulate with the articular facets of occipital condyles, forming the atlantoccipital joints. 7. The transverse ligament tubercles are the 2 rough, small prominences found along the medial aspects of both the right and left lateral masses of the atlas first cervical vertebra. They provide attachment sites for the transverse ligament of atlas. Understanding your cervical vertebrae is crucial for maintaining neck health and preventing injuries. If you found this video helpful, don't forget to hit the like button and subscribe for more insights into your anatomy. Also, share this video with anyone who might benefit from it. If you have any questions or need further clarification, drop a comment below and I'll be happy to help.